Thank you for reaching out. It's really an honor to be here. And to the Roten family, I have the pleasure of meeting Mrs. Joyce Roten this evening. Real honor, real pleasure, and of course, Dr. Alice Roten Classic. I hope my children want to honor me the way you have honored your mom. It's really inspiring to see. And to Brad again, thank you for the introduction, and also for leading as the CEO, really the inspiration and the vision for this amazing treasure of a resource in the Cade exam here in Gainesville. And then I also want to thank Dr. Gordon Mitchell, who gave opening remarks. And I call Gordon my brother from another mother, Dr. Mitchell. And he mentioned that the McKnight Brain Institute and Dr. Allen's vision of creating an institute focused to the brain was instrumental in bringing him to the University of Florida. And similarly, I came to visit UF for the first time in 2012. And I'll talk a little bit about that journey to join the Brain Tumor Center, the Department of Neurosurgery, and the McKnight Brain Institute. But the Brain Institute had a huge impact on my interest in relocating our research team here, because I saw the opportunity to just do amazing work here at University of Florida with the integrated collaborative efforts that were really already in place at the McKnight Brain Institute. We actually shared, our labs were literally on the same floor at the MBI, and given that we were both Dr. Mitchells, I spent many years reading Gordon's emails, getting his packages to our lab as well, and sometimes the invoices and bills going the opposite direction. So it was great to always exchange and return those packages and emails, and I was fine with leaving the bills in Gordon's hands if he could take care of them. But it's great to see him tonight. So I'm going to, I understand that we have some high school students here from the Mirror Leadership Academy. Is that right? Can I see show of hands of the students that are here? Before I go through, I'm going to spend maybe 20 minutes or so describing some of the work and really a journey to try to find new treatments and solutions for children and adults who are battling one of the most difficult cancers that we do face, malignant brain tumors. I just want to say to you all who are students, and I understand most of them, I think, in the early stages of high school, I'm going to be describing a journey and a vision that as a young student, I had a dream and a goal of trying to have a career spent in medicine and research, and hopefully trying to contribute to helping outcomes for other patients, other people. And I just want to say to you all, if you have any dreams, goals, visions, or aspirations of what you want to do, and you're willing to work for it, and you don't give up on that dream or goal, no matter how many people tell you you can't. You heard Dr. Roten's story of people telling him or situations saying to him that he was not going to be able to achieve those goals. I've had similar, discouragement along the way. But I just want to say to you students, hold fast to those dreams and goals, and hopefully the inspiration of Dr. Roten's story, and I'll share some experiences, can just, you'll leave with that belief that anything you can conceive, achieve, and work for, you can believe and conceive and work for, you can absolutely achieve. So I'm really glad to see you all here tonight. I hope I get a chance to meet some of you before I go. So I'm going to talk to you about fighting brain cancer, trying to use the immune system. And many of us are familiar with how our immune system plays a role in protecting us against infections, but the idea that the immune system could also recognize cancer as a foreign invader, and similar to a virus or bacterial infection, actually reject those tumor cells, has been a concept that has been in the field for a long time. People have been working for decades on the potential to use the immune system to fight cancer, and you heard how Dr. Roten was inspired by a course that he took and seeing an opportunity to pursue a career in neurosurgery and in medicine. I, in college, was thinking about being a computer programmer, and during a course that I was taking, I read a book about a physician who was working on using the immune system to fight melanoma. And I thought it was the most fascinating concept I had heard, the idea that the body could be trained or used to fight cancer, and decided that that's what I wanted to pursue. So for the last, I guess it's hard to admit, but 33 years, I've been on that journey in terms of training and working in that field. I do a few disclosures. I have invented some patents that have been licensed by pharmaceutical companies. I have done some consulting for companies in the industry, and then co-founded a biotech firm for oncology. that has also licensed some biotech intellectual properties from the University of Florida. I won't be speaking about those in any great detail, but it should make people aware that those interests and development are there. So when we think about, you've heard, I think, just a fantastic introduction to the brain and the debate on whether it's the seat of the soul for the human being, but it certainly is the control center for our functions, personality, memory, learning, motor function, speech, and so much more. And patients who develop cancer in the central nervous system, called malignant brain tumors, really, this is a cancer that attacks the very seed of who we are as a being and the functions that we need to live a high-quality life. It's one of the more challenging cancers to treat. Primary brain tumors are the tumors that actually arise in the central nervous system or spinal cord, and they affect about 25,000 people a year here in the United States. Metastatic brain cancers are cancers that start elsewhere in the body but then spread to the brain, and they are about 10 times more common than even primary brain tumors. And in fact, up to a third of patients who develop metastatic cancer ultimately develop metastases that spread to the brain. And whether tumors arise in the brain or spread there, despite our best efforts with surgery, radiation, and chemotherapy and other types of treatments, unfortunately, malignant brain tumor is a pretty poor prognosis, with most patients succumbing to that disease in less than a year to a year and a half. So this is an area where we really have a desperate need for improved treatments. In children now, brain tumors are the leading cause of cancer-related deaths, affecting about 4,000 kids a year. And this is because we've made tremendous advances in treating leukemias and more common blood cancers in children that used to be just as deadly and now can be cured in about 90-95% of children. But unfortunately, brain tumors still have this unmet need of being oftentimes incurable. And so the vision that we have had here at the University of Florida and at the Brain Tumor Center and within the Department of Neurosurgery, but shared by many colleagues, is to develop safe and curative treatments for children and adults that are affected with malignant brain tumors. So I want to talk to you a little bit about the journey of building a brain tumor center here. And in many ways, I feel like this is a continuation of the extraordinary legacy that Dr. Duane started here at the University of Florida and within the Department of Neurosurgery. And so this is the history of the neurosurgery chairs, the leaders of our Department of Neurosurgery. And you heard about Dr. Al Rowe, who was the founding chair of the Division of Neurosurgery and what subsequently became the Department of Neurosurgery. He trained a young surgeon, Dr. William Friedman, who was the chairman of neurosurgery when I joined the University of Florida in 2013. You heard about Dr. Rowe's vision of building a brain institute and also laying the roadmap for elegant neurosurgery in the brain. Dr. Friedman's mom passed from a glioblastoma in 2001. He had been a brain tumor surgeon for most of his career, but he said when his mom died of brain cancer, he dedicated his life to wanting to find a cure for this disease. And as the chair, he said, I want to use all the power and resources I have to make the Department of Neurosurgery at the University of Florida a major part of the story of how we ultimately cure brain cancer. And it's really Dr. Friedman's vision and passion about that, the reason why our team is here today. I received a call from Dr. Friedman when I was at Duke University, where I'd been for 20 years, about coming to look at the leadership role here in leading the Brain Tumor Center at UF. I was honored to be considered, but I politely declined. And I began to tell him why I just had a lot of things at Duke that would preclude me from moving. And Bill Friedman said to me mid-sentence, listen, I didn't call you to hear about all the great things you think you have going on at Duke. You wouldn't be getting this call if you didn't know good things going on there, but they're not as good as what we're doing in Florida. So why don't you come take care of that? And I will tell you, and this is a lesson to this particular students, if you are have a conviction and a vision, no matter how audacious that goal is, you can attract the team and the people and the resources ultimately to achieve that goal. When I met Bill Friedman, he told that story of his mom dying of brain cancer. I came thinking I would spend a day in Gainesville and go home. And back to Duke, and he said, when my mom died of brain cancer, I dedicated my life to trying to find a cure for this disease. And as a neurosurgeon, understanding what that meant, he was the only person I had met in my entire career as a physician who had ever talked about curing this disease. And I said, this is a person who's committed his life to a cause I can get behind. And then when I saw what the University of Florida had in place and the you think of your trip to Florida? And I said, well, they're not lying. I think we're moving to the U.S. She was blown away, but she has loved it for the last 4 years. That vision is carried with our current chair, Dr. Duane. When he took over as chairman, his vision was to have a top 5 neurosurgery department in the United States in research, in terms of NIH funding and rankings. And at the time when we joined here, we were ranked about number 17 in the country in terms of NIH funding. And I don't know if you can see this quite well, but this was in 2021, 3 years after he took over as chair. UF Neurosurgery became the 4th ranked neurosurgery department in the United States in research funding, and has maintained that 2024 rankings. About having amazing people in your own town that, maybe we aren't aware of. You have one of the best neurosurgery departments in the entire country right here in Gainesville, and it's been that way since Dr. Roden built it, but it just continues to try to build another legacy moving forward. All right, I'm going to give you a quick snapshot of where we are in Brain Tumor Center. Currently, we have about 115 employees now that are dedicated to taking care of patients with brain tumors or working on research to find cures for these patients. When we joined in 2012, there were 14 of us. And our research expenditures at the time, because of a very significant gift, was $1.5 million a year in research expenditures. This coming year will be at over $18.5 million in supporting brain tumor research. I will mention, and then I'll jump into some of the work we did. When we moved our group here, we brought a team of 10 with us that came to the University of Florida. We actually moved into the Roden laboratory to start our work. I have to admit, that was extraordinarily intimidating. You talk about following the giants, to have the opportunity for our team to actually carry forward their research in Dr. Roden's lab. Weighed heavily on me. I think Laura Dickinson is here somewhere. She was Dr. Roden's administrative assistant for how many years?
17.
17 years. They also let me know that Laura Dickinson would be supporting and being the administrative assistant for our program. So I thought, my goodness, we're moving into Dr. Roden's lab. We have to live up to the expectations there. And then the person who followed this amazing person for 17 years is going to be following what we're doing. I thought I was extremely intimidated. And I remember when our laboratory opened, I did have the chance to walk in and actually see Dr. Roden. He was in the lab, walking around looking. I tried to duck out so he wouldn't see me, but I really wondered what was he going to say. And I'll never forget, I walked in, I introduced myself, of course, and he said, I can't tell you how excited I am about your team coming to the University of Florida. He said, as a neurosurgeon, we will continue to do everything we can to take the best care of our patients. And has spent his career doing that. He said, but we won't cure glioblastoma with surgery. He said, it's going to take a different approach. And I couldn't be more excited than to have your team and what you're working on using the immune system to fight cancer, carrying out this work in this space. And that just meant the world to me and to our team. So I'm going to just spend a few minutes on just what we are pursuing in that work. We also attract some of the brightest talent from around the country and the world to work in the laboratory. This is just a snapshot of 4 of the newest faculty members who joined the team right out of their training. And I don't have time to tell you about their background, but they're all doing incredible things. Whether UCLA, National Cancer Institute, they have a clinic. Dr. Ian had the opportunity to go train here at UF, but had the opportunity to go many places and chose to stay on to really join the team. So let's talk about trying to use the immune system to fight cancer. This is a picture, actually, in the middle of your screen, you're seeing a tumor cell. And surrounding that tumor cell are immune cells called T cells, or what we call killer T cells of the immune system. These are the cells that fight viral infections, but in this case, you can see these cells are actually probing this tumor cell because they have been activated that there is something not correct in the environment. And if you can see this lower cell that's now come into contact with the tumor cell, you can see all these red granules. These are actually molecules that your T cells When they detect a foreign cell that they want to get rid of, they inject these into the cell and then secrete enzymes that actually digest that cell from the inside out and lead to it being killed. And they're so specific that they can kill a tumor cell, and a normal cell right next to it, they can recognize is not abnormal and leave it completely unharmed. And so the goal of immunotherapy is to try to get this kind of reaction against all of the tumor cells that the surgeons can't remove with surgery or that radiation and chemotherapy don't reach. And at the University of Florida, over the last 10 years, 12 years, we have developed a number of different approaches to try to engage patients' own immune system in fighting cancer. So one of them is something called therapeutic cancer vaccines. This is not like a vaccine to prevent you from getting an infection or an illness. This is an immune stimulus to try to stimulate a response, like a vaccine, but in a patient that has already developed cancer. And we have used what are called dendritic cell vaccines. Think of dendritic cells as these are the armies of your the generals of your immune system that kind of tell those T cells what to attack. We actually use those from patients, instruct them in a way of what is foreign in the patient's tumor, and then give these dendritic cells back to the patient so that those generals can go activate the army against the tumor cells. More recently, we are using little particles instead of the cells to now deliver that information in the body to the dendritic cells. These are called nanoparticle vaccines. Again, discovered, conceived of, developed, and translated all the way into clinical trials here at UF. Those soldiers, the T cells, another approach that's being taken is instead of instructing the generals, we actually take the soldiers of the immune system, those killer T cells, out of the patient's body, train them what their cancer, what's foreign and what's different about their own cancer cells, grow these T cells up to huge numbers, and give them back to patients so that now they can seek out those tumor cells and destroy them. And then a really brilliant investigator here at UF, named Dr. Flores, she discovered that you can use stem cells from your own bone marrow and reprogram the body's response to cancer so that now you can respond to drugs that are very effective in fighting melanomas or lung cancers and make them effective for brain cancer. The other challenge in treating these brain tumors is the brain is protected by something called the blood-brain barrier, or BBB. This is to keep, viruses out, chemicals out that could be harmful to the brain, but it also means many of the drugs that we want to use to treat cancer that are effective in other sites can't get into the brain due to this BBB barrier. And so our neurosurgeons are using lasers that can be used to actually heat and kill the tumor, but they also, during that heating, open up the blood-brain barrier, so now we can get medicines in that otherwise would not get in to kind of clean up those tumor cells that the surgeons can't get to. And so we have clinical trials already in patients testing these approaches that look very promising. So this is just a snapshot of those different categories and all of the clinical trials that are going on here at the University of Florida testing these approaches. And these are all trials that started as an idea with either a smart graduate student or a scientist in the lab, went all the way through the process of investigation, testing, and when we thought they looked promising for treating a patient at UF, we actually have the ability to scale up these treatments. We have manufacturing facilities right on campus that can make medicines for patients. So we don't need a company or a pharmaceutical company to decide they want to pursue these treatments. If they look very promising, we can go right to the FDA for permission to treat patients. And so this is a list of trials to date for both children and adults that have been discovered, developed, and translated into new therapies here at the University of Florida. This has really created a destination center for brain tumor treatment. What you're seeing in the orange dots are where patients who've been treated for brain tumors have come from in the state of Florida. And then on the other side, you're looking at where patients throughout the United States have come to Gainesville, maybe from foreign countries, to be treated for malignant brain tumors. And that's really because of the specialized and unique therapies that we offer here. I'm going to show you a few examples of what this looks like in terms of responses in patients. So this is what's called an MRI of a patient's brain. You're looking at really an image through a patient's brain. The back of the patient is on the bottom. The front of the patient's head is on the top. And where those arrows are pointing is this is what a glioblastoma looks like in your brain. The normal brain should just be gray, almost a dark gray color, but those areas of white are actually glioblastoma tumor cells that could not be taken out by the neurosurgeon because of the delicate location of where this tumor is located. This patient had a very aggressive glioblastoma, couldn't be resected fully, has a really extreme poor prognosis in terms of survival, but they enrolled on a clinical trial here where we used those dendritic cell vaccines I described to you before to instruct his immune system on what was foreign in that tumor. And in the subsequent scan, you can see 6 months later, all of those areas of white are completely gone. This was a complete response to a glioblastoma patient in 2018. I'm happy to say that now he is approaching, this July will be 7 years cancer-free from a glioblastoma treatment. And I really many years of investigations to bring that forward, but I can tell you he's doing better today than he was when he was diagnosed. He's even improving in cognition and other functions. This is Sandy. Sandy was diagnosed with a glioblastoma when she was 61 years old. Was told that probably, again, based on age and other characteristics, she could expect about 12 to 15 months of survival. She is more than 10 years out now from having received the same treatment as the other patient that I showed you. And 6 grandkids later, she had no grandchildren when she started on the clinical trial, and this is just a feature that was done on her where she's with one of her grandsons. And again, a remarkable response to treatment in this patient. We've also seen some similar responses in pediatric cancers. This is a different tumor called medulloblastoma. Grows in a different part of the brain, the back of the brain here on the bottom of the screen. And again, it should be all dark gray for a normal brain, but you see all these areas of white, almost looks like tracing around the entire, what we call cerebellum. This is a metastatic medulloblastoma that came back after standard treatment of radiation and chemotherapy. And not only had spread through the brain, but had metastasized even outside of the brain, into the bone marrow, thoracic cavity, rib cage. This patient was in a wheelchair when he came to enroll in the clinical trial, not because he couldn't walk, but just to the pain from his spinal cord, and had been told that he should enter hospice care before they sought out the clinical trial. And so if you're looking at the MRI post receiving immunotherapy treatment, all of those areas of white enhancement in his cerebellum were gone. This is another area of his brain. You can again see all of the areas of white coating of his entire brain. And you can see there this was essentially a complete response to treatment. He actually was able to go back to working part-time after 2 months of being on the trial. And so we've seen some really amazing responses to particularly the immune response in patients. This last example I'll show you, this is probably our, they're all superstars, but this is a patient who at 2 years old was diagnosed with a medulloblastoma, was treated with standard therapy, which is about a year long of really intense treatment, and then unfortunately, at 4 years of age, she relapsed with medulloblastoma, and so again, when this tumor comes back, we really don't have any effective standard treatments. She enrolled on the immunotherapy protocol, the same that I showed that prior patient. And then this is a feature that was done on her when she was 5 years old and just completed a year long of immunotherapy treatment. And then this is a, I don't know how to do TikTok, but she did send the team a TikTok video as an update of how she's doing. And she has been, you would not even recognize that she's gone through cancer treatment. And so, again, it's just moving for these remarkable responders. So, what does the future look like? What are we working on? I've shown you some of the potential and amazing things that the immune system can do, but we don't see a response like this in all patients. And what we are trying to understand is what's the difference between either the immune response or the way the therapy is actually generated in that patient that has led to really fantastic immune responses, and what I would say at least long-term durable responses, maybe even cures. And how can we learn from that and apply it to other patients? And so we're using artificial intelligence and a lot of data analysis to really unravel the complexity of the immune system. There's a new initiative that we have launched at UF that's being supported by a strategic initiative fund called the Intelligent Immunotherapy Initiative, and this is really to try to bring together the supercomputing power that we have at UF, lots of data, not just from our own patients, but from collaborators across the world, to really try to link the understanding of disease and brain cancer and immune response, and to even expand that to other diseases. And so there's many partners involved in this initiative, both at the University of Florida, NVIDIA, a powerhouse in AI, is involved in moving this project forward, and Sandbox is an AI company that really focuses on drug development and is engaged in how can we really personalize immunotherapy so that we can get the best treatment for those patients. I'll give you one last example of how we're doing that. So we've developed an algorithm that looks at all of the complexity of the patient's own tumor and the unique features of their own immune response. And then using the Hypergator computer, which is we have here at UF, it's actually the most powerful supercomputer of any university or any academic center in the world. We can analyze the data of the genetics and the biology of the patient's own immune system and analyze that against literally tens of thousands of patients in terms of what's known about immune response, and figure out what is, or at least predict, what is the likely best targets for the immune system for that patient, and make an absolutely personalized vaccine or T-cell therapy for them. This is being supported by the National Cancer Institute, and we hope to move into clinical trial within the next year or two. So in summary, immunotherapy targeting brain tumors is feasible, it's safe in both pediatric and adult patients. We have seen some remarkable responses and potential for this treatment, but we need improvements that can expand this to benefit more patients. And we think advances in technologies such as AI and collaboration with others that we're being led from UM can really bring new solutions and personalized therapies for patients with cancer. So this is just a snapshot of the immunotherapy team, and obviously there's too many people to thank, both for the work and the support, but especially the patients and families that put their trust in and Dr. Roker highlighted that in the caring and compassionate team that puts their care at the center of what we're trying to focus on. We really appreciate their participation in helping move the field forward. So thank you for your attention.